you. Okay, so we're going to just talk you through and give a very brief demonstration now on oscillatory stretching. So oscillatory stretching is a very simple and straightforward technique, and it's really just a method of alleviating any discomfort or pain that might arise during a passive static stretch. So if we show you, for the sake of example, a stretch on soleus, if I were working on J here and I take a knee into flexion to shorten the gastrocs and just apply some pressure to put soleus on stretch by dorsiflexing the foot, if Jade reports to me that she's feeling that's uncomfortable or it starts to cramp or anything like that, obviously to be safe I would want to take it off stretch and make sure that she's comfortable again. What I can do then is just estimate how long it took for that pain to start or that discomfort, and then to work within that sort of time frame. So if Jade said to me it was perhaps 3 or 4 seconds before it became uncomfortable, what I could now do is just stretch for say 2 or 3 seconds and release. Stretch 2 or 3 seconds and release. What's important now is to keep sight of what my aims are as I'm stretching. If my original intention was to hold the stretch long enough for a developmental stretch, then by doing this oscillatory stretching, I'm aware of the fact that I'm obviously de-stressing the tissues. The key thing is by how much I'm de-stressing. And if I can keep this stretch or the tissues reasonably on stretch within the last sort of 15 to 20 degrees of that joint angle, then I may still achieve a developmental stretch and the effects of creep deformation. If obviously that is very uncomfortable still for my client, I may have to de-stress further by taking the foot further into plantar flexion and to de-stress for longer before the pain subsides and I start to stretch again. Now obviously in those circumstances, by changing those parameters, then I'm no longer going to be able to achieve a developmental stretch. But clearly if my client was feeling some discomfort, then all I'm trying to do now is get it back to a position where it is comfortable for her. We can start to experiment with mixing this up with PNF. This has not been well researched, but we've shown anecdotally you can increase the range still reasonably significantly by using the client to actively contract the muscle against some resistance. So the way that we would do this is, again, I would take that into a passive stretch position. Jay, can you now gently push my forearm and relax? I take it back to passive, push again, relax, push again, relax. And then after a while, the client will understand exactly what she has to do, and we can work together and just keep that movement going. And you can probably now see that range of dorsiflexion increasing as a result of that. Okay, just stop there. So by combining a contraction, although we're not controlling to what intensity they're contracting because there's not time for that, we're hoping that we still get the benefits of active contractile stretching and a passive stretch, and that, as you've seen, will elicit a further stretch than just oscillatory on its own. So that's something that you perhaps can experiment with. And obviously if you have athletes who are a little bit sensitive to that stretch feeling, this can be a good alternative. Okay, so pause there just for a moment. Don't have to switch off. We'll move straight on and do STR next. We'll just allow a bit of a pause and then Matthew will break that up. Okay, so the next technique that we're going to demonstrate is STR, which stands for soft tissue release. I would normally be standing on that side of the couch, but for the sake of demonstration, and keeping the leg exposed to you. I'm going to work from the opposite side. So a little bit awkward, just keep that in mind when you try and replicate this for yourself. Now the indications for using soft tissue release are going to be when you find that there is a tight or fibrotic area of a muscle that you want to isolate. Now in these instances, if for example in the medial hamstrings, in the distal area here, we found some real tight fibrotic area that we wanted to try and loosen up, your normal methods of passive stretching, static stretching, PNF stretching, any of those will of course lengthen the whole musculotendinous unit between origin and insertion. And the chances are during that stretch process, the more flexible tissues will give further, whilst these tight fibrotic areas will stay inflexible. So how do we deal with that? Soft tissue release is an ideal way of what we call locking out or isolating that area of muscle, and it depends on its location as to which joint we're going to use near that area to facilitate that stretch. So I'll show you and explain a little bit further what I mean. If you keep your imagination firm on the fact that I have found this tight area here that I want to isolate, I would then first of all shorten the muscle by flexing the knee, and I will then use some method of applying what we call a lock. Now when I say some method, you may need to experiment depending on the different densities of muscle tissue that you will work on, the different girth of limbs, different areas of the body, as to what you actually use. So it may be thumb pressure, it may be heel of hand, it can be knuckles, and if you find that you're not getting enough purchase on the skin, you can put a towel there as well to try and make sure that you get that lock firm. So a couple of the things leading into this: firstly, as you can appreciate, minimal oil is very important because you need to be able to establish a lock into the skin without any sliding. The second thing about the lock is that you've got to make sure it's firm enough to actually hold the tissues in place, and you also need to be locking away from the joint action that you're going to be using. So in this instance, I'm going to use knee extension for Jade to stretch this area here. So I'm going to experiment using knuckles on fairly dry skin. So I would roll the knuckles up towards the origins so you can see the skin stretching straight away. Hold that position there, and then I'm going to passively move the joint into extension. Just check with Jade, can you feel the stretch? As I bring the joint back into flexion, I lift the pressure off, move slightly, just a fraction, reapply, and take the joint through its range of movement again. And after a while, what will happen is that you'll get a nice rhythmical lock and stretch, lock and stretch. And every now and again you want to keep just checking with your client that they can feel that. Significantly, what will indicate to you that you are getting a successful lock is that with a joint range such as the knee here, going through a full 90 degrees should be impossible. Because by locking out there, if I was able, and I'll just release the pressure a bit for the sake of demonstration, if I'm able to go to full extension, the chances are these tissues are sliding underneath my lock and it's not being successful. So from this position, we can both, I hope, feel the stretch once we get to a certain position. After a while, if you want to advance the intensity of this, or you're finding you're not getting enough lock with one hand, you can get your client to actively move the joint for you. So Jade, if I can ask you to hold your knee in flexion like so. I need to move my hands into position so that our legs and arms are not going to be entangled, so I'm going to put hands in here like so and lock with two thumbs. Jade, can you just extend your knee until you feel a stretch and back up. As she comes back into flexion, I reapply, and away you go again, and back up. And again, I just lift and lock again, and we can both feel the stretch through the tissues, and Jade's obviously limited on how far she can extend the knee. And one would do that rhythmically for quite a while. In relative terms, one could work this for sort of 2 or 3 minutes, which on a confined area of tissue is quite a long time, but that will have a profound effect on a very isolated area of tissue in terms of loosening it up and making it more flexible. And obviously one would precede that with the normal effleurage, petrissage techniques to really warm the area and make it nice and pliable before we start. There is a third method of STR, so we've seen passive and we've seen active. One can also do this weight bearing with the person standing as well. So a lot of practitioners who use STR and favour it a lot may use this in pre or post event circumstances through the clothing when a client is actually standing. Okay, I think I'll switch off. Was that complete?